I'll also tape. So what I'll do to start to help increase that proprioception as part of your home program too is I'll tape around. So do like a screw around your back, hit the tape. So can you set your shoulder blades again for me? I'm just doing a square around. And I'd use Zuco tape again. I don't have any on me, but I'd use Zuco tape for added support, so you can use this as part of your home program. I'll protect and add to your shoulder stability. So if you relax, do you feel like, so relax for a second? Do you still feel a bit of a pull on your shoulder blades in the back?
Yeah.
Good. So that's going to help you reinforce that proprioceptive feedback for how to keep your shoulder blades back throughout the course of the day and in your work job as a teacher.
Okay.
So if you want to turn around, you can show all our friends at home the tape job on the back. Wait, come back. So there's the tape job on the back. Good. At this point, is your neck starting to get a little bit sore?
No.
Are you sure?
Yeah.
Yeah, it's starting to get a bit sore. Okay. If you want to have a seat, what I'm going to do is hook you up to a TENS unit. Okay. Yeah, if that makes you more comfortable, you can put your shirt back on. Okay. So what I'm going to do with the TENS is I'm going to plug it in, and I'm just going to bracket the pain. So I know you have some pain in your right facet at C5. So I'm going to put one pad below the injury, just to the right of the spine, and I'm going to put one pad just below the ear. Make sure those are secure and stuck. And then I'm going to set my TENS unit to 80 hertz with a pulse width of 150 microseconds. So here's my pad placement on the back of the neck. Make sure those are secure. Okay. So what I'm going to do is I'm just going to slowly turn it up. Let me know when you start to feel like tingly sensation. Oh, before I do this, before I actually stick these on, I just want to make sure. So you said you had no metal implants or pacemakers, anything like that?
No.
You know, have no epilepsy or like seizures, anything like that? No diabetes, no heart conditions or cancer?
No.
And the site was clean. The site was clean and shaven so that the pads will actually stick.
Mm-hmm.
Good. So I just want to test sharp and dull really quick. So I'm going to do the same thing. I'm just going to test sharp and dull. So this is what sharp will feel like. This would be dull. So you can close your eyes and let me know what you feel when I touch you.
Dull. 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 Sharp. 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 Dull.
Good. So that was all good. So I'm going to stick the pads back on, the same placement as before, bracket the painful area. I'm going to use the same parameters as before. Make sure those stick. Then I'm going to slowly turn it up. Let me know when you feel the numbness and tingling. Basically, like the heat was used to draw the blood into the area and help renew the area a little bit with new blood, and help reduce pain. And because we're reducing pain, it's also decreasing the muscle spasm. What we're going to do with this is basically, have you had used the TENS unit before?
Yeah.
So basically you have this knowledge of how it feels, but basically what we're going to do is try to make you feel something on the surface of the skin. So basically we're going to have you feel this tingling on the surface of the skin. And that's going to trick your brain into feeling that rather than the pain in your neck. So what I'm going to do, you okay with that? If we proceed? So what I'm going to do is slowly turn up the unit. If you've used it before, you have an idea of how it feels with the numbness and like the pins and needles kind of feeling. It shouldn't be painful, but if it might feel a little weird or maybe even uncomfortable. If it does feel painful or you don't like the feeling, let me know. I can turn it off. Or if it's set too high of intensity, I can slowly turn it down. Over time, if you start to get used to it, let me know and we can turn up the unit so that it still sends the same stimuli through and you get the same effect. Okay. So I'm going to slowly turn it up. Let me know when you start to feel it.
Yeah, I can feel it there.
Okay, can we go a little bit further to get comfortable?
Yeah.
Is that good right there?
Yes.
Okay, perfect. So we're going to set that on for 15 minutes to help with reduce the pain and muscle spasm in the area as well, because we're reducing pain. So after 15 minutes, I'm going to take it off. Are you doing anything cardio-wise, or were you doing anything before the accident, like any biking, anything like that?
No.
No? Okay. Well, what I'm going to introduce is just seated biking, so that it doesn't involve your neck too much. Just try to stay in a position that you're comfortable in, that's not bad for your posture. And then what I'll have you do is just cycle. So to help maintain your cardiovascular fitness, do you know how to keep track of your heart rate when you're exercising?
Yeah.
Perfect. So what you're going to do is you're going to exercise about 40% of your heart rate for a minute and a half, and then for the next 30 seconds you're going to pedal at about 85% of your heart rate max.
Okay.
And you'll do this for a total of 20 minutes with interval training. Okay. Other than that, for your home program, I want to keep the tape on, and I want you to work on that scap setting like we talked about. As we progress, we can start to add weight, stuff like that, and just the gentle range of motion exercises around your neck in pain-free range, as well as doing the trap stretches.
Okay.
And that exercise diary I talked about too.
Okay.
About that.
Sounds good.
Any questions?
No.
Okay, perfect. If you're still sore after today, try to do anything that helps reduce the pain. So if that's heat, if that's using ice at all, you can do that as well for like 15-minute periods at a time.
Okay.
Sound good?
Yeah.
Great, thanks.